Earlier this week, comments from the World Health Organization about the apparent danger of mixing COVID-19 vaccines caused confusion and concern among Canadians. In our weekly Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey provided some clarity about the context of the comments and the continued safety of mixing vaccines.
I think we all were quite surprised when we saw the headline. The quote was actually taken out of context. So I think that that's the first thing that we have to recognize. Yes. The physician from the World Health Organization was actually saying that individuals, people, should not be trying to figure out their own vaccination schedules. I've actually personally heard in other countries where people say, oh, I got 2 doses of this vaccine. Now this new vaccine is available. I'm going to try and get a 3rd dose of this one or a 4th dose of this one. And I think it's that practice in particular that she was talking about. Don't mix and match your doses. As an individual, don't decide which vaccines you're going to get, how many vaccines you're going to get. Leave that to your public health authorities. Yes. I think it's important to note that the recommendations that were made in Canada were based on evidence, even more evidence that's coming out. It was also based on our current situation in Canada of vaccine supply.
Doctor, there's a follow-up question that I got on Instagram actually regarding this mixing of vaccines. So if it's not okay to mix the 3rd and 4th shot, presumably if you get it, how is it okay to mix the 1st and 2nd shot?
So actually, it may be okay to mix a 3rd and 4th dose. We actually are not recommending a 3rd or 4th dose in anyone right now. Now, if we need a 3rd dose or even a 4th dose, that decision will be made based on the evidence, and it will be a decision for the population. What they don't want you doing is deciding as an individual. In some countries, you can go to a pharmacy and buy a lot of things, including prescription medications that you can't buy here. So it's really, I think, talking about that type of decision-making for 3rd and 4th doses. We have no guidelines right now in Ontario for a 3rd dose. And if we recommend a 3rd dose, and it is an interchangeable schedule, it will be based on the data, the best data available at the time.
For more answers from this Q&A and to submit for our next session, you can go to our website, citynews.ca/COVID answers. You can also access the page by scanning the QR code on your screen. For City News, I'm Dilshad Burman.